Plantar fasciitis is one of the most common reasons people stop walking, hiking, running, or even just standing comfortably. And what I hear all the time is this: I did everything I was told, and it still keeps coming back. If that sounds familiar, this video will help you understand why plantar fasciitis so often lingers or returns, and what actually needs to change for long-term relief. Because plantar fasciitis usually is not the root problem, it's a signal that something else in the system isn't working the way it should. Hi, I'm Dr. Jessica Lack. I'm a physical therapist and foot and ankle specialist, and I have spent decades helping active people, hikers, and athletes work through foot and ankle pain that keeps coming back. I'm passionate about this topic because plantar fasciitis is one of the most misunderstood conditions I see, and most people are never told why it's happening in the first place. So today I want to talk to you and walk you through why plantar fasciitis keeps coming back and what actually helps it heal long term. Let's start with what plantar fasciitis usually feels like, because the pattern of symptoms gives us very important clues. It typically starts with pain in your heel or arch pain. It's often sharp or a stabbing sensation. It tends to be worse with first steps in the morning out of bed. It also will often be painful after sitting or resting for a period of time and when you stand back up on your feet. It also tends to warm up with movement. So typically when you get up in the morning out of bed and you have that sharp stabbing pain in the center of your heel, sometimes it's more toward the inside of the heel or in the arch, it'll typically start to settle down after 10 to 15 minutes or so. And then it starts to feel better. And then it only feels better until you start doing increased activity, and then it becomes worse again. So this also gets worse after you've stood or walked for longer periods of time. So what this suggests to me is that it's a loading issue. It's not just inflammation. So plantar fasciitis, itis means inflammation of, and plantar fascia is the location of where the fascia is on the bottom of your foot. And where that fascia attaches to the heel is typically, it's been known as an inflammatory process, but that's honestly been questioned in recent research. So key takeaways for this is that the symptoms are not random. They're telling us how the foot is being stressed. When someone is diagnosed with plantar fasciitis, the advice is usually very similar across the board. I'm sure those of you that are listening to this either are experiencing plantar fasciitis yourself, or you know someone that has it, and that's why you're here with me today. So these things will sound familiar to you. Almost everything across the board, everyone says, stretch your calves. Yeah, you've heard that before. Stretch the plantar fascia, ice your heel, or use a frozen water bottle on your heel. Rest. Use anti-inflammatory medications. Most people are given either inserts or orthotics. And you've been heard to foam roll and massage and do all these different things. Well, this advice makes sense if you're interested in treating the symptoms that you're experiencing. But what these do not look at is these particular treatments are not looking at the root cause. Why do we have the inflammation? Why don't we look at what's causing the inflammation, if it's actually inflammation, right? That's the other thing. We don't know if it's inflammation. We don't know what's actually causing the pain. I think sometimes it is inflammation, and I think sometimes it's not. So most of the treatment that we are given is either to treat inflammation, or it's to stretch out tissue that's perceived to be tight. Problem is, are those things true? And even if they're the symptoms, why are we treating the symptoms? Why aren't we looking at what's causing it? So let's take a look at that. So Here's the part that most people are never told, and it's the real reason plantar fasciitis keeps returning. So, the plantar fascia, knowing that it's a soft tissue that lies on the bottom of our foot, it's absorbing a force that it shouldn't be. So, if we look at why is it painful, why is it tight, why is it have trigger points in it and causing pain, and what the answer I always see is that it's absorbing a force that it is not meant to be absorbing. And I see that the reason this is happening is that when a person has limited ankle, I'm using my wrist as an example, but when a person has limited ankle range of motion, when their ankle does not bend back or dorsiflex the way that it's intended, then our ankle, instead of sitting in a nice neutral resting position, instead it falls inward or pronates, typically. And when this happens, our ankle falls in and stays pronated or overpronates too early or stays that way, it causes a significant stress on the fascia, causing a load and extra forces that it can't handle. Also, what happens is when we don't have enough motion in our ankle, we will see a compensation up the chain. So what that means is if our ankles don't bend back all the way when we fall inward, it doesn't just put a stress on the fascia, but it also keeps our foot in that pronated position, and it tends to overly stress the posterior tib tendon, and it also will stress our knees and our hips, and it changes our pattern. And when we have compensation up the chain like that, it changes our standing mechanics and it changes our walking mechanics. And this is why the fascia becomes overloaded. Have you noticed that your symptoms will return when you get back to normal activity? So you start to increase your walking, increase your standing, and then suddenly you're like, gosh darn it, my foot hurts again. Why do these symptoms return? Well, the way I like to explain it is, have you ever taken your car in to the tire shop to get new tires because you've noticed that your tires are bald? Well, we have 4 tires on our car, right? And when you notice that they're worn, you go in for new ones, and typically they will check the alignment of your car first before they put new tires on. Well, why do you think they do that? Well, it makes perfect sense when you think about the car, right? So just like our bodies, when the alignment of the car is off, how the car is aligned is going to determine where is the stress on the different parts of the tire, right? Well, the same thing is true with our body. When our joints are not stacked from our ankle to our knee to our hip, if we're standing knock-kneed or pigeon-toed or ducky with our feet turned out, what happens is we now are putting different stresses or forces on our tires, well, our feet, right? And so the difference is we only have one set of feet. We can't change ours. We can't just go trade them in for a new model like we can for our tires, right? And so once that mechanic tells us that there's an alignment problem, we're kind of relieved because we can get it fixed, right? And then we put new tires on, and then that next set of tires should take all the normal beating that tires do and get back to normal activity with our car and not worry about our tires popping or wearing out or whatever. Well, our feet are the same way. So once we notice that our alignment is off, there's very simple things that we can do to fix them. And this makes a lot more sense now, doesn't it? That when you do ice and massage and rest and anti-inflammatories and all the things, or an orthotic, right? All these different things will help calm the tissue temporarily. But if every step you take still feeds that same stress onto your foot, well, then the pain just comes back. So hopefully that makes a little bit more sense as to why your foot is getting stressed and why you're having the pain on it. So one of the biggest misconceptions about plantar fasciitis is believing that the plantar fascia itself is the main problem. But plantar fasciitis is just the messenger. It's your body's way of telling you that something is breaking down, right? So pain. I believe that God did not give us pain to see how tough we are, did he? Pain is our body's way of letting us know that something is wrong. And that pain in our heel is our body's way of letting us know that there's a problem happening. And the fascia itself, it's the messenger, but it's not the cause. The tissue is not weak. The tissue is not fragile. It's just responding to a repeated overload from the poor alignment above it. And treating the symptoms is not going to get you anywhere except for temporary relief. So the most important thing is to change your movement pattern, which will take the stress off your feet so that your feet can finally begin to heal. And that's why reoccurrence of this problem is so common, because we aren't ever typically addressing why that stress is happening and taking it away so that we can heal and finally get rid of this frustrating condition. So if you don't change the pattern, that tissue keeps paying the price. So what actually helps plantar fasciitis resolve long term, it's not just calming the pain, it's changing how force moves through the system. So these are the ways that we're going to do that. The first way is by restoring ankle motion. It's absolutely critical that we test and assess how much ankle bending or moving back or dorsiflexion we have in our foot, in our ankle. Then we're going to improve the force distribution through the foot by changing our walking and standing patterns.
Okay.
So when we change the way in which we stand, the way that our joints
Good.
are
All
lined
the
up,
way for me.
and then change the way that we walk, we are then actually unloading the foot abnormally, and then we're putting normal loads so that we can improve how our foot functions so that we can finally heal from the plantar fasciitis. The next thing that we're going to do is reduce the unnecessary strain that's being put on the fascia. And we do this by actually releasing the tissue. And we don't do this through stretching or through massage, but we do it through the release it technique. And there's a very pain-free way to shorten and hold tissue, to release it, to take away the trigger points, which are typically a primary reason why we have pain. And this is a really important way that we remove the strain from the fascia in order to reduce pain and to finally get this problem to go away. The next thing that we do is we then need to progress movement rather than avoiding it. It's been really tough for you, I know, because when your heel hurts, it's really hard to exercise and it's really hard to start moving again because it hurts. So once we restore the motion and get the pattern better and restore the tissue back to its soft, supple state and reduce the pain, then we can finally start to get back to normal motion. And we do that by gradually adding movement to your tolerance. And there's a very clear way that we progress so that we're not re-injuring and re-traumatizing that fascia and causing re-injury. And in doing this, this really helps to calm the nervous system, and it's why the tissue can finally settle down and heal. So finally, when the mechanics improve, that plantar fascia no longer has to keep yelling for help. If you've been dealing with plantar fasciitis for months or for even years, it doesn't mean you're broken or that your foot is weak. It usually means that the root cause has not been addressed yet. And when movement patterns and mechanics change, the body often responds far better than people expect. So if this has helped you understand your heel pain a little bit better, then that's a win. And if you're interested in learning more how to change your movement patterns and learn specific ways to improve your ankle range of motion, then I will be doing that in this next video. So please go ahead and watch this next video and you will learn all these key points in how to restore your alignment and finally get rid of your plantar fasciitis and be pain-free and get back to your regular life. If you have benefited from this video, please like and subscribe, and then you will get notified when there's new videos available.